luckily not here, just see my 2-year-old son running around wearing just a diaper with a large, like it's a car that holds Hot Wheels, a large Hot Wheels on his head running around screaming. So, um,
What superhero is he trying to impersonate?
Hot Wheels man, I have no idea. He's 2. He's having the best day he's ever had. Him and his sister are on spring break,
Hey, living his
and
best life.
yeah, I'm sure in 2 minutes he'll come back and he'll be swinging a bat. It's funny. My daughter she is like a rambunctious, high energy kid, um, but my son is just a guy who's a dude. He is. He acts like a boy, jumps around, tries to break things. Like he has all of those. Like if it's not a Hot Wheel or an airplane, he doesn't care about it. Like it's just funny to see somebody who's like so purely a dude.
Hello, and welcome to the Best DPC podcast, the world's #1 podcast for all things direct primary care. I am your host, Wayne Lowry. I am not a doctor, but my dad jokes will leave you in stitches. Today, I am thrilled to have Matt Hoff with us. He is the CEO of ASM Solutions, a former paratrooper with the 82nd Airborne, and a pharmacy guru who is about to make medication more accessible for you and for me. From jumping out of planes to running a family business, Matt's got a story, and we're excited to introduce him to you today. Welcome, Matt.
Thanks, Wayne. I as a dad, I really like the dad jokes, so keep those coming because that is right up my alley.
Okay, well, trust me, none of them are funny. That's the best part of a dad joke is
That's the
the
best part.
cringe factor. So I know we talked a little bit about your kids just a moment ago. You got younger kids. I will tell you, there is something special about having a teenage daughter when you tell that joke and it's so cringe and they cringe at it and you know it. And it's just like full of pride, full of joy, knowing that you've embarrassed your daughter. But on the flip side, when you think you said something cool and then they look at you with embarrassment and they do the no, dad, don't. That's the moment of like pure terror of like I am old and no longer awesome. And so I tell you, it's like the total opposite. If you know going in that you're trying to embarrass them, it's great. But when you do it accidentally, it's the worst 5 minutes of your life. But thankfully, at our age, 5 minutes you've forgotten, you moved on. So
Yeah, been there, done that. Been embarrassed plenty of times, and it's going to happen plenty more times in the future. So,
so Matt, tell us about yourself. Where do you live? What do you do? Just who are you, Matt? Tell the world.
live in Atlanta, Georgia. Have a 2-year-old named Eddie and an almost 7-year-old named Libby, and live there with my wife Ann. So, I was a very interesting story to get into healthcare and pharmacy. I went to grew up in Atlanta and then went to West Point and I graduated high school in 2003. So I remember I was actually in a class called History of the Modern Middle East when the second plane struck,
Oh
and
wow.
it was I'm one of like 7 different West Point classes that claims to be the class of 9/11. But remember having that moment because this was right when we were doing the application process. Applying to West Point is really a 2-year ordeal. Um, and, you grew up in the 90s, you had Gulf War when you were a little kid that you don't really remember. And um, war was kind of movies. And this was sort of like I'm actually going to go sign up and do this absolutely
This is
insane
real.
thing. Yeah,
Yeah, this is real.
not that my parents were ever not proud of it, just we're not a military family. I may as well have said that I was going to, go try to become a cosmonaut in Kazakhstan. Like it was just so far outside of what they expected was going to happen. So went to West Point, was a military history major, a very practical degree that I would recommend to anybody. Huge, just a huge, huge job opportunity for
Lot
military
of
history
opportunity
majors.
there.
Yeah, so
Yeah.
much money in telling people what happened at Austerlitz. Um, and became an infantry officer. So did the training at it's again Fort Benning now, which is stupid, but went through and did all the infantry training. Went to again, it's Fort Bragg again, but that's what they were called when I was there, and um, then was a platoon leader with 3rd Brigade 82nd. We went to Iraq, part of Operation Iraqi Freedom in 2008, 2009. We were there sort of at like the end of the surge, beginning of what they called the status of forces or SOFA. So, my war stories are like most people's fishing stories. I definitely caught fish storing it, but wasn't exactly Moby Dick or Old Man in the Sea. But careful what you wish for. At the
Yeah.
same time, I had friends that were in some terrible situations, and to paraphrase what one of them says, um, firefights sound really cool until you're in them. So was proud of what I did. If you're watching this online, I had this cool local artist do um, painting inspired by my unit. So you have the 82nd patch and the Ranger tab and the Combat Infantryman's badge. So leave no doubt that I got mine. And then 3rd Brigade 82nd is the Panther Brigade. So the guy does some pretty cool stuff. He's done stuff with Atlanta Zoo and some other things. And in the middle of it, that kind of gem in the forehead is the unit's distinguished unit insignia. So pretty cool Zoom background that I got made, but
I mean, I like my Zoom background, but it's a picture of a monkey dressed in a suit. I mean, yours carries a little bit more weight.
see, I don't need a picture of a monkey dressed in a suit because I'm basically a monkey dressed in a suit at all times. So why would you have a picture of yourself, right? So
Yeah, exactly.
after that,
That's
I was
actually my dad. That's my dad, actually. So,
yeah.
and he's not going to watch this. He's probably not going to watch this. So I could probably say that and get away with it.
um, yeah. Then I was a ranger instructor, and after that, decided to get out of the army and didn't really know what I wanted to do. Just that I wanted to not be in the army anymore. So applied for some jobs and applied for some business schools and got into business school at Georgia Tech and got a job working at Home Depot's corporate. And instead of making a decision, just decided to do both at the same time. Did that for a couple of years, and then as I was finishing up grad school, I was trying to figure out what I was going to do and didn't want to do the typical consulting thing where you go and fire a bunch of
Yeah,
people and tell everybody.
consultants are the worst. Let me tell you, can't
Yeah,
stand those guys.
it is. But I think there's a difference between like the healthcare inspired consultants that are trying to make like a positive change in the world that have been there, done that. And when you first come out and, you know, frankly, the idea of spending
You
my
haven't,
day making a very pretty PowerPoint slide that has no
yeah,
meaning to the world, I was like, I could have stayed in the army and done that. So it was, it would have been the irony of ironies to have spent all that money to get a fancy degree just to go do the same stuff I would have done if I'd stayed in, minus medals and baggy pants. So I had sworn I would never join the family business, but when they say everybody has a price, they found mine, and no,
they said, "Come on."
it it was more than that. One of the things that Home Depot is a great company, and I really enjoyed my time there, but I didn't feel like anything I was doing was making the world a better place to be. And with healthcare, you know that at the end of the day, you're dealing with real patients, with real people, with real things that are affecting real systems. So, I go to bed every night knowing that somebody somewhere's life is marginally better because they were able to afford their medication or were able to get access to their medication or were able to better take care of a difficult patient because of something that AS Meds is doing for the world, and it just makes you feel like you're doing something, right?
Mhm. So, you know, you travel a lot, right? I mean, you're not really you mentioned that you are at your home office as if that's where you spend most of your days, but you travel quite a bit.
I am over 1 million miles lifetime on Delta. They take all of my money and all of my time, but
Yeah, but they probably give you nice upgrades.
at the end of the day, you're still in the same metal tube. I get an extra, I get an extra 6 inches of leg room, but at 5'4", it isn't doing all that much for me.
You really spread out, just sprawl out, really
Yeah, I can
just
do the
lean back and
full
enjoy
like
it.
starfish. Yeah,
So, so traveling as much as you have, tell me a little bit about some of those experiences. Like, are you a foodie? Do you like to try interesting foods?
I am a foodie, so I like going to Texas because Texas is a good food place.
It is. You are
You
correct,
know,
sir.
unfortunately, people think that you're doing like the business travel, and there's like, oh, you're going to Austin and San Diego in the same week. Like that's got to be amazing. It's like, well, you spend 90% of your time getting there. Um, most of the rest of it asleep and answering emails. You'll get like one or two nice meals, and then you'll have a meeting in an office that could be in Sheboygan. But I spend a lot of time in places that people are not going to for a vacation.
Uh-huh.
So business travel really just becomes um, like a method of survival. Like people ask me if anybody's getting to the point in their life or taking a sales job. This is my sage advice. People will ask you, how do you do it? And it's a really simple answer. You get in the Uber and you drive to the airport. The more you think about it and the more you're like, I've spent the equivalent of 7 weeks out of 10 weeks away from living out of a suitcase and,
Yeah.
eating stuff out of a minibar. That's just going to get you depressed. This is your
Yeah.
mental health moment. Just don't think about certain things and you'll be much happier because of it.
I want to take a quick break to talk about bestdpc.com. Are you a doctor looking to break free from the headaches of insurance and take control of your practice? Or maybe you're an employer searching for an affordable healthcare solution that actually works. At bestdpc.com, we cut through the noise and connect you with the country's best direct primary care clinics. Whether you're a patient tired of surprise medical bills or a physician ready to build a thriving membership based practice, we've got the tools and resources you need. Find the best DPC doctors near you, get expert advice, and take the first step towards a better healthcare. Visit bestdpc.com today and see why direct primary care is the future of medicine. That's bestdpc.com because great healthcare should be simple, affordable, and built around you. Well, there's got to be some highlights from travel. I mean, I imagine there's certain places you've gone, and have you been able to take your family on any of those trips?
None of the work trips yet, but I'll say that I've been to all 50 states. If I'm going someplace for the first time, I always do try to carve out a little bit of time to go see something or do something that I've never done before. But, the nice thing about what I do is I really don't have any clients that I wouldn't want to spend a meal or a drink with. So
Yeah.
just because you're going and seeing quality people who are doing quality work, it's always inherently a little bit interesting. There's definitely been some really fun things. Like we've sponsored some fun events at Hints. So a couple years ago when they hosted it at Red Rocks and they had that, was it a Pink Floyd cover band at Red
That was an
Rocks?
awesome concert.
Yeah.
I
So
will say that was an awesome concert.
that was my first concert at Red Rocks. And it was kind of cool because I got, pictures with sponsored by me. We didn't sponsor the whole thing, just a dinner for the folks that were at Hints. But it was me and two of my coworkers, and one of them kept talking about how she was this huge Pink Floyd fan, and frankly, Pink Floyd was no longer in existence several years before she was even thought of. So we're like, "Oh, was your favorite song Freebird?" So we spent the entire time, rooting her event, asking her if they were going to play Freebird.
Yeah,
Um,
I've got a good Freebirds story for you.
yeah.
So when I was since we're on the subject, so when I was, oh man, this is a long time ago. We had a gentleman that attended our church, and he would always ask on Wednesday nights. Let's just say he had challenges in life. He had challenges, okay. And so every once in a while they'd say, "Hey, would you like to request a song for us to lead at church?" And he go, "Freebird, Freebird, man." I was like, "This is church. How about I'll fly away. Let's go that route." But you know,
Similar vein. So when I was when I was in the 82nd, you can request certain things if you're enlisted and re-enlist. And
yeah.
every morning they would play over the loudspeakers along all of the run routes the 82nd Airborne chorus, which was like it's an a cappella singing group that sings, army songs. It
Mhm.
is it is like if you were going to choose something to torture somebody with while they worked out, it is like a half step away from the Frozen soundtrack, right? Like it is that close. So somebody whose name I'll never know reenlisted, but his thing that he wanted for it was you have to play Metallica during PT one morning, and this got out. Thousands of people in a division. This got out to everybody. Everybody was very excited. I'm not the biggest Metallica fan in the world, but it could have been the Wiggles. Anything other than the 82nd Airborne chorus would have made my day. And they played, this poor this poor SOB gave them 3 extra years of his life for Metallica, and they repaid him by playing one song. So they played, Master of Puppets. Everybody's having a great day, and then all of a sudden you hear them. The very first song that starts the recording every single time was the very next thing, and the amount of hearts that were breaking and smiles that disappeared from faces. Man,
You'll never
it,
forget it.
never forget it. There's some things that
Yeah,
only the army can do to ruin your day, and that was definitely
that was
that
one of
was
them.
definitely an evil genius's plan.
Oh. Well, let's transition over to AS Meds and tell us a little bit about what you've got going on. I mean, obviously you mentioned you were working at Home Depot and you got the call to go work for the family business. How has that transition been? How long have you been there? Uh, tell me a little bit about that.
Well, it's been a 10-year transition. So, um, no, I've been with the company for a decade. Started in summer 2020 or 2015, believe it or not. Held a number of different positions there, and it's been an interesting experience. I think I was really hesitant to work with family. I think a lot of people are hesitant to work with family. I think 9 times out of 10, it's just it's a recipe for strife and conflict. But man, if my dad and I got along when I was a teenager, the way that we get along at work, um, he probably would still have a full head of hair. But um, it's just been a
So
really
is he still in the business? Is he still working with you?
so he's stepped back from the CEO role about 2 years ago, but he's the executive chairman, so he runs the board for the company. And there's
So
a yeah, there's another family involved too, so he kind of spearheads the folks who make sure I'm not getting too crazy.
okay, cool. So you've been CEO now then for 2 years?
2 years, and I was COO, excuse me, before that, and then I headed up a position called strategic alliances. So I had half of our customer service and accounts. I had all of sales, and then I had all of our vendor negotiations. So we're really unique in the space in that we're buying most of our drugs directly from the manufacturer. So we try to cut out as many middlemen as possible. Not only does that help lower prices, but it also shortens the supply chain. So we have a better quality of supply, but we also know what's going on and we know what's new and what's next, which helps us just stay really sharp.
So by buying direct, you see that, I mean, obviously that's gonna create some cost savings. What does that mean for, a traditional pharmacy? Like, how does that differentiate you and going down to the CVS?
So a different, different pharmacy, you don't really know what medication you're going to get most of the time. You'll know what drug, and there could be 10 manufacturers, but your small white round pill could turn into a light blue oblong pill.
Mhm.
And, not to say that our drugs never change because manufacturers exit the market, but for the most part, we have more consistency of the things that cause patient confusion than other groups would. We're a repackager in addition to being a wholesaler. So we're licensed by the FDA as a manufacturer. So we have additional steps and scrutiny that we have to hit. And doing that gives us a lot more efficiency, a lot more scale and volume. And that helps keep down the operating costs, which gives us more time to focus on our customers and their patients.
So, coming from a military background, you obviously lived a very structured life. How has that transitioned to your role as CEO? Do you find yourself, um, leaning into some of the old habits?
Not as much as you think. I sort of burnt myself out on the anal retentiveness about hospital corners on beds and shiny shoes. And I've like checked that box and
Moved
have
on.
moved on with it. Yeah, I really have a passion for making sure that we're set up for growth. We've been doing a phenomenal amount of new business. We've been doing a phenomenal amount of helping more clients and patients, getting us more efficient and getting us to those next steps. But the biggest thing that you learn in the military is everybody may sort of look like a automaton from the outside, and you think military, it's very lockstep. The American Army is not, the Prussian Army, right? Like there's there's a lot more free thought. There's a lot more dissent. There's a lot more individuality um, than you'd think. And so when you take that, you take sort of a defined box and you say, here's the mission, here's what you have to think inside of. It's amazing how much creativity can happen in that box. So one of the things I've really enjoyed of structuring the team over the last couple of years is you find those really, really talented people. And we have an amazingly talented team, and making sure they're set up to do the things that they do best and let them run with it. And, not everybody's going to be able to do everything as well as everybody else. Like it is not plug and play by any stretch of the imagination. But you also learn that in the military. Like, hey, you may have three lieutenants and each of them have the same, credentials and skill sets and training, but A focuses and does exceptionally well at A's types of tasks and B does the same for B's, and knowing when to use A for A and B to B, but knowing that they all have to have a certain baseline. That's a lesson that I don't think people realize that you learn in the military, because people think everybody goes in and they say turn right and everybody does a right face. Um, but it really in practicality just isn't like that.
So let's talk a minute about your within your business, the tech stack. I'm really curious of to know more about what you're using for tech day to day, and then
Mhm.
also what kind of integration have you brought your system into?
So tech is a very interesting thing for us. We are going through a massive modernization right now. Um, it's really exciting. We just brought a new CTO on in January, named Lance, and he's absolutely phenomenal. Our VP of IT, who stayed with us, who shepherded us through the last couple of years, is incredibly smart. Um, but it's part of that, like we're taking things up even to a higher level. So
Uh-huh.
I'm really excited about it. Where we are now versus where we were 2 years ago, you couldn't even compare. But I'm being a little cagey on my answer because we're sort of in the middle of this
so
really,
so y'all
really
are building
rapid
out your own
modernization.
So y'all
Yeah.
are building out your own system. So it's all custom. You've
Hmm.
built your own platform, and then what systems are you able to integrate with, or what is the goal as far as integration?
So you have to think of there's two different types of tech stacks that we're working with. One is our back end, our internal, and that's we're a manufacturing company, so it's invoices, order productions, everything else like that. It's our data analytics, it's our order receiving. That's going through a tremendous modernization. What really triggered it a couple years ago is a law that takes effect in May that requires every individual bottle of medication to be serialized. It's called DSCSA. It's not really well known, especially in the DPC space, but not every manufacturer and wholesaler is going to cross the finish line. And if you're buying from somebody who does not meet that standard, or if your dispensing platform doesn't meet that standard, you're going to be in violation of a federal law. So that's something that should be of growing importance. So that's half of
It's
our
a
tech stack. I'm sorry.
let me I'm gonna put a pin in that because I want to come back and
Hmm.
talk about that. So when we come back to that, so I'm just making a little note here because I want to talk more about that in the legislative conversation about what that might look like in the future. But back on the front end of your tech stack, what does that look like?
So there's a number of really great solutions out there for the actual physician dispensing. So if you're the DPC doc, what do you have in hand that allows you to get our prepackaged medication into a patient's hands? So we own a system that we call Pedigree. We give that away for free. All of it's integrated with SureScript, so you can e-prescribe, and it goes right into the system. And then MD Scripts is one of our longtime partners. Most of DPC is using MD Scripts because there's integration with systems like Hint, but all of them have that awesome integration with SureScripts. At the end of the day, a doctor doesn't want to be playing pharmacists. It's not a good use of
Right.
their time. This is two not doctors talking about a good use of a
Yeah.
doctor's
Yeah.
time, but the National Association of Chain Drug Stores did a study before COVID, and they found that it costs a pharmacy almost $13 to dispense a medication. That's with the tech doing the pill counting and the pharmacist doing the verification. And then that process takes about 5-ish minutes. With our process, it takes less than 2 minutes to dispense a medication. So one of the things that I think is missed is the cost of medication, the cost of the pill absolutely matters to how expensive the drug is, but the cost of the doctor's time is even more valuable. You can get a lot more pennies than you can get those minutes back that somebody's counting out, counting to 90 instead of actually seeing their patients and making sure they understand what the medication is and what it's for.
Take a quick break to talk about scalebyseo.com. If you run a direct primary care clinic, you already know the power of patient relationships. But here's the thing, patients can't sign up if they can't find you. That's where Scale by SEO comes in. We help DPC clinics get seen where people are searching. So you're not just waiting for word of mouth referrals. With the right SEO strategy, your practice becomes the obvious choice when people are looking for better healthcare options. If you're not showing up where they're searching, you're missing out. Be visible, get found, grow your practice. Don't leave growth to chance. Visit scalebyseo.com today and let's get your clinic in front of the right people. So your platform, obviously this is the best DPC podcast. So DPC, direct primary care, is going to be a focus of our
Mhm.
audience. Are you working with DPCs as well as other healthcare systems or providers, or what's your typical market look like?
We're all over. We work with DPCs, we work with urgent cares, we work with groups that are dedicated to employer health. We work with even some groups that are still on the dark side that adjudicate to payers. But my end of the day, my mission is make it easier for providers to get medication into patients' hands. Um, I have always been supportive of the DPC movement. We've been there. We've put the blood, sweat, and tear. We go out to DC and help with the lobbying, but um, just because we haven't been able to convert everybody to see the light doesn't mean that their patients need to suffer. So
Right.
we do work with all kinds, but on the DPC front, I think our biggest value add is between the on-site medication dispensing and what we can do for a mail order home delivery program. We can get the medications directly to the patient in the way that's the most efficient for the doctor, and that does overall the most good. There's some effective altruism in there.
Can you describe really the difference between those two strategies? And obviously,
Yeah,
some states like Texas, there's some laws, and we'll get into that in a moment. But can you just describe for our listeners the difference between those two processes?
sure. So on-site medication dispensing is you go into your doctor's office. Your DPC provider says, "Hey Matt, you need an atorvastatin and a Z pack," and then they put it in the EMR. It gets e-prescribed to the dispensing software. Their MA will grab the prepackaged, pre-counted medication, barcode scan it out, the label goes on the meds. They hand it to you. You pay a cash price, or they bill it to your employer, and in less than 2 minutes, you're on your way with your drugs. Versus having to go to a pharmacy and waiting for God knows how long to get your medications and pay whatever the copay is going to be, and shop around with a good RX card and all that other crazy stuff. The home
All
delivery
right.
program is a little different. Home delivery
Okay.
program, they say, hey Wayne, you're due for a refill. I'm sending the script in, and it's going to come right to your house. So that's kind of the excuse me. That's kind of the Amazon of the system. The two work really well together. You don't need to go into the office for a refill unless the doctor decides you need to go into the office. So it gives them some time back to make sure you're getting their medication. They can be charging you for it. They can be making sure you're taking it so you're getting the outcomes without them needing to take time from their schedule to actually hand you a bottle. So the two programs are symbiotic together like that. A Z pack is not going to come through the mail in time for it to be useful to you.
Right.
So you have times for both, but having that combination program is something that I think is underutilized in DPC. I think the best DPCs know that getting patients their medication is going to save them money and improve their health in the long term. There's only a 60% chance that most drugs are picked up. 60% is the nationwide adherence rate. If you
Oh,
dispense,
wow.
that takes it over 98%.
Now,
So,
when you're dispensing, like, or what you're typically rolling out, say in a typical DBC clinic, are you talking about 1,000 different,
no.
types of medication, or is it the top most useful emergency? Like, how does it relate to what I might get at a CVS or the hometown pharmacy?
So I'll use the joke everybody says about DPC. If you've seen one DPC, you've seen one
You've seen
DPC.
one DBC?
Um,
Yeah.
so the doctors have
That's
full
my dad.
control over.
That's a good dad joke. That's a good dad joke. We'll put it
It's
in
a good
there.
dad joke. No, but the doctor has full control over their formulary. So some doctors are going to say, I want to cover about 80% of what I'm going to prescribe. So versus a CVS or a independent pharmacy, they're going to need to cover about 100% of what any prescriber could prescribe. So
Gotcha.
the first step back is you're only going to cover what you're writing for. If you don't write for uh, Hep C medications, you should not carry Hep C medications, right?
Right.
Um, so you only have what you're going to write for, and then we always say the sweet spot is you want to carry enough medications to cover about 60 to 80% of what you're going to be prescribing. Now,
Okay.
let's think about this though. You could have a super active population in Colorado, and everybody skis or mountain bikes. If they're not skiing, they're mountain biking, right? And they're relatively young, they're relatively healthy. you're probably carrying antibiotics and, maybe some stuff for sore muscles, right? If you had a more elderly population in Southern Florida or Arizona, and those people have a bevy of medications, you may be carrying close to 100 drugs because everybody's on a statin, everybody's on something for
Right.
diabetes, everybody's on something for this, that, or the other. So one of the beauties of the program is no order minimums, stock what you need. We have great dating, so anything you buy has about 14 months before it expires or more, and you control what you carry. So you really are only carrying the things you need to take care of your patients. And the mail order, well, that has an almost unlimited formulary. Like we said, it's not going to work great for the acute care meds, but if you have a one-off patient, you have only one of your high performing, high mountain biking, high snowboarding patients needs a statin. Well, you can still take care of that patient because you can do that through the mail order without having to increase
So
what you stock.
so what about on the mail order? How do you price that? Is that a do y'all do like a capitated
Same
rate,
price.
or is it you just pay per prescription, or what's
Mhm.
y'all's what's your model
Per,
on that?
Same price per prescription. So we have a consistent drug price, and we're the only people who do this between on site and mail order. And I'm a very strong believer that you're going to bill per prescription. If you're going to go into a capitated plan, it turns into a Planet Fitness, right? Planet
Mhm.
Fitness makes money for people who don't show up.
Yeah.
If I'm charging you for the drugs that you don't take, and that's how I make my money, I'm gonna, I'm disincentivized to have good service. So I want to give the best service. I want to give the fastest rate. I want to give, a very good price for the medications we're providing. But I want to make sure that folks are going to have an enjoyable experience that keeps them following the doctor's orders. If I'm doing a capitated plan, I make more money when you choose to use your pharmacy benefit. And that's just totally against the spirit of what DPC should be.
Awesome. So if you were to say who is your ideal client, who would you say would be your ideal client? What are you looking for as far as is it small mom and pop shops, DPCs? Are you looking for large employer, people that are serving large employers, or do you really have an ideal client that you would say?
I don't say I'd have an ideal client. Obviously, from a from my responsibilities as a CEO, I have to say the larger in the employer, typically the more opportunities we have to serve patients.
Yeah.
But I really have a passion for working with the small mom and pops. Um, I think that those DPCs, um, the all the different things they have to do to run an effective business, this is something that becomes daunting for them. So having the ability to make it easy to provide those extra services like the home delivery, it gives them the ability to have to go head to head with the bigger systems and have a parity of offerings without having to have this gigantic office staff, because most of the time, the doctor is also the accountant, is also the the front desk and the back of house. So
Yeah.
I really love working with them. I love the, if you've seen one DPC, you've seen one DPC, because we love being a solutions company. It's right in our name. We're AS Medication Solutions. We love trying to find, okay, you're mostly seeing pediatric patients in your practice. You just have a lot of folks that are having a lot of babies. What can we do to help make that better? So that's why we've been spending a lot of time working on a vaccine program. It's that's the kind of stuff that keeps the job fun. As much
Mhm.
as we love, high volumes and sales, we really love making sure that we keep that human element alive. And there's no better place to do that than in DPC.
So what are some of the trends you're seeing in pharmacy? Um, what are some of the trends?
Well, I think we'd have to come back for a whole other hour on GLP-1s, but
Well, we will come back. Don't worry. We're gonna
good.
have you on more often. I'm already looking at the clock going, I've got so many questions. But who would you say or what is something that's like in the news relevant right now in regards
It,
to pharmacy?
pharmacy access and pharmacy closure is the most important thing. When I started 10 years ago, there were 75,000 retail pharmacies nationwide. We're down to below 72,000. And then you look at Walgreens announced 500 store closures by August of this year. CVS announced store closures in the hundreds. Where are these patients going to get their medications? So, if your job as a doctor is to treat a patient and make sure they get better, they have to follow the doctor's orders, right? If you say you
Right.
need to take a torvastatin, or you need to do this, or you need to go to physical therapy, or eat an apple a day, well, if there's no apples in the grocery store, how is the patient going to eat an apple a day? If there's no
Mhm.
grocery stores, how are they going to get apples? So we
Right.
have a very simple and elegant solution to solve that problem of pharmacy deserts. And that's really the biggest trend we're seeing is it's getting harder and harder for doctors, especially in rural areas and in urban areas, to get patients the medications they need to follow the doctor's orders.
So what are y'all doing to address that?
Well, doing things like coming on Best DPC podcasts, so DPCs know it's the right thing to do. We're speaking at a number of conferences coming up. We're continuing to scream from a mountaintop about it. Some states make it harder than others. Texas is one of two states that outright prohibits physician dispensing, which,
Well, let's talk
here's,
about that.
yeah.
Let's talk about that. So, I mean, you've spent a lot of time in Texas. In fact, I think we were both in Austin a couple of years ago at the same time. I know you've done a lot of work in that area. So tell me a little bit about what's going on in Texas. And what was the other state that's also in the same boat?
Massachusetts. Yeah.
Massachusetts. All
If you can
right.
name another two thing that those guys have in common politically,
You
uh,
ready? Alex
okay,
Bregman. Alex Bregman. Houston Astro, now Boston Red Sox.
there you go. I've been telling people you guys both had teams in the NBA Finals last year.
I don't
Um,
know. I don't know about that. I
no,
don't know
well,
anything about that team from Dallas. I don't care about them.
is that recent after the trade of Luca, or is that are you a longtime Spurs fan?
No, I'm a Houston guy originally, so I'm
Mm.
Houston Rockets, Houston Astros, Houston Texans, and a good friend is all about the Mavericks and the Rangers and all them. So I try to avoid those teams as much as possible.
Well,
But
as a
anyway,
as a
sorry.
as a non-Texan, I'll stay away from that. But
Yeah, so the difference, okay, so Massachusetts, Texas, on-site this dispensing is not legal. So what can be done and what's in the works there?
there's been a number of legislators who have been addressing this issue and have been aware of it, that are pushing forward some legislation. We've been working really closely with different medical societies that also realize, hey, a doctor's hands are tied more in Texas than they are in Oklahoma and Arizona, and that's just not right. Um, we're hopeful that some legislation will go through. It's really a legislative fix, but the goal is to get Texas, and they're sort of leading the charge between the two states onto um, parity with the rest of the country. Montana had the same issue a number of years ago, and you know their their state supreme court saw the light and made a ruling. It's good for patients. It does not hurt pharmacies. It's not a scope creep. It's not any of the things that people try to castigate it as. It is just something that is common, safe, easy, and effective that helps solve what is a very real problem, which is pharmacies, unfortunately, are shutting down. And I'm not anti-pharmacy. I know it's a logical conclusion, but pharmacist signs my paycheck. Our
I was
company's
gonna
been in,
say,
yeah.
how I could see it is, you know, in a sense, it's just creating a different kind of competition because then it would open up for those same local pharmacies to have direct contracts with their local DPCs or clinics to provide that on site as well. So, in one sense, you might argue, or it might be argued that it's just opening it up to competition. that might be beneficial to the employees. So, I mean, it would be no way a monopoly. In other words, it's not like this happens in all of the local pharmacies. I can see the big pharmacies fighting this tooth and nail. But yeah,
But at the end of the day, like we said, a DPC is not going to be a pharmacist. The doctor doesn't want to play pharmacy. They're going to do, a limited number of scripts for the what they want to treat for their patients, and it's not going to take away from all of the rest of it. So there's always going to be a space there, and frankly, people forget a pharmacy is a doctor or pharmacy. They have a lot to add as a member of a care team. So if you have that complicated patient with 9 medications, hell yeah, send them to the pharmacist. That's when you need to use that person. It's in many cases just making sure that the white round pills were counted to 90 is, you're having a doctor do something that can be done by a machine.
gotcha. So what's cooking? We're almost out of time, so I want to make sure we cover anything that is of urgent concern. So what do you got cooking right now? Anything exciting you want to talk about in the last few minutes we have?
Yeah, I think the legislative opportunity in Texas is really real. So anybody who's listening in Texas or Massachusetts or a state that makes it more difficult for physicians to dispense or to delegate that act of dispensing to a mid-level that works for them, call your congressman, call your legislators at the state level, get loud about it. Most of the time this falls below the radar for folks, but this is the time to get loud, especially in Texas. Let's reach out to folks and make sure they know that, hey, I'm a doctor. I'm having a hard time treating my patients, and this is a solution for it.
All right. So we are now going to transition to our last little section. It's a little section we call Keeping It Reals.
All
The purpose
right.
of this section is kind of a rapid fire approach. Going to ask some questions, get some great sound bites. I mean, I've already had great sound bites. You've been awesome. But hopefully we'll get something that I can't promise you'll go viral. But at the very least, you will definitely get some additional exposure with these awesome answers on the social media platforms. So starting off on keeping it reals, what is the wildest thing your kid has done in the last hour?
Well, I think running around in just the diaper with Hot Wheels cars being worn as a hat is probably, in the last hour, the biggest thing I've seen.
Yeah, I was gonna say it helps that I already knew that.
Yeah.
All right. Next question. It's a real simple question. I'm just going to say it, and then I want to get your honest reaction. GLP-1.
A lot of good that can be done, a lot of abuse going on. So it's part of the future, but needs to be done carefully, and is not a magic bullet.
Awesome. If you could fix one thing about the pharmacy industry with a snap of your fingers, what would it be? You've got your magic wand, Matt. What are you going to fix?
I would give parity in all states that allows physicians to dispense medication. It's simple.
All right. Last question. How did your military experience shape your approach to healthcare and leadership?
I think my employees would say, unfortunately, probably too much. They have heard, I think a lot of folks give military expressions and examples as a cliche. I do it because that's the only way my brain functions. So, your tax dollars did a very good job of making sure that that part of me is in there to stay.
Awesome. Well, thanks, Matt. That's it for today's episode of the Best DPC podcast. Big thanks to Matt Hoff for joining us and sharing some profound knowledge. I think that's a good word for it. Profound knowledge and a few great stories. Matt, it wasn't long enough. We've got to do this again. Maybe when Texas session wraps up, we can get some really dive into what happened this session and get some more insight on that. But thanks for having, or thank you for coming, being a part of this show. If you want to check out his work, we'll have all of his contact information in the notes, in the show notes below. But check out their website, a-smeds.com, and connect with Matt on LinkedIn. He's on there, he's active. Follow him and you can learn more. For more DPC awesomeness, visit our bestdpc.com website. Follow us on social media. Now, if you're listening to us on a podcast format, iTunes, Spotify, you name it, we're there. Or you may have found us on YouTube. Either way, subscribe to our channel, share it to a friend, share it to an enemy. Just put it out there for the world to see. Every little bit helps. We're not charging you to watch this podcast, so pass along the free information and help us continue to grow DPC. Until next time, keep demanding the best for your health with direct primary care. Bye bye.
Best DPC podcast. We're spitting truth on the mic. American healthcare stinks. A maze of red tape and greed that's out of sight. It's time for new choices. A revolution in care. Wherever